Ribs burger.
McRibs.
Oh, McRibs burger, sorry.
Okay.
Tony
You need to
Robbins.
feel what it feels like though, see, that's the advantage. We'll trade off. Alright. So, we're talking about the upper part today. We'll do the other ribs another day, so remind me, don't forget. So, you know adjusting upper thoracics is hard, right? How do you adjust that? It's tough. So a lot of times what I'll do is I'll just go and I'll adjust on the ribs. And as I do that, I find that frees up this whole area. I think a couple of you I've worked with cervical extension on, down to T4. Have we done that? Where's that been the other? Yeah, okay. So when you extend, cervical extension goes all the way down to T4. It should. Find a little kid, ask them to look at the ceiling, and their whole back goes like that. So normal extensions down to T4. Most people don't have it because we sit like this all day. This whole area here gets jammed. So it needs to be mobilized. I find the best way to adjust this area on the spine is the ADP adjustment, or to get the ribs. So to find the ribs, you go laterally and you make sure you're on the rib, so not on the muscle. So when you press, you can find a sore muscle, or you can find a sore rib. And you gotta kind of say, is it sore because I'm pressing the muscle on the rib, or because I'm pressing the rib? So you gotta make sure you're really anchored on that and you're mobilizing the rib to see if that's what is sore or not. So you kind of press till you feel a rib, and you press one side and the other side, and you're feeling for what's more fixated in P to A, what lacks movement, because what lacks movement is what we adjust. And I feel right there, I feel it stuck. You feel that? Which side feels worse, right or left?
Right.
Okay, so that's what I'm going to adjust. All right? Now if you want to get a little more sophisticated, the rib will subluxate either inferior rotated or superior rotated. Okay? So you can challenge the rib. Look up. You can push down or you can push up to see which motion is lacking. So there's that rib. I'm going to push down on it and see how it bounces. I'm going to push up on it. It's not moving up. So it needs to move up more, so I'm going to adjust it up. Make sense? Okay. So the way I like to do ribs, I just start with this part on the spine and I slide off. I kind of do a tissue traction. So I need to get over here to the rib. Obviously I can't pull the tissue, at least on Joseph, all the way over there. So I'll slide off a little bit and get right on that rib. Now I can push straight down, a little superior, or a little inferior, depending on what I want to do. So, am I pushing hard? Okay, I'm using a lot of weight. It's all body weight. I'm not like that, because then I can't use my body weight. I have to push. There's no pushing here. Okay? It's all body weight. Alright, so I'm really leaning in there. We've done this one before, remember?
Hey.
Spirit fingers, okay. And then take the head to the side, and it feels like you've got you've got a lot of tension there between the neck and the rib. But are you okay? Is this uncomfortable? A little bit. All right. I always ask the patient if they're doing okay, and then it's a press here and a push there. Can I do it? Yeah. Okay. And a little movement there. All right? Okay, so that's a rib move. Now, if you guys don't have the strength and the speed to do that, just mobilize. So, there's value in mobilization, and just chart it as grade 4 mobilization. And as you do it, eventually things will start to adjust because you'll get the finesse of it, you'll figure out the amount of movement, you'll figure out how to position the head, and things will start to go up. And you go, oh, that's a rib move. Okay? You'll also get things to move in the neck when you do that. That's fine. Okay, you got it. Okay. And then the other one is for the first rib. first rib, you have to kind of palpate differently. You gotta get up here on top and I'm pushing down. Kind of comparing if one side feels more fixated or is more painful. Is this side more painful? Okay. So the way I adjust that, and I don't know, I don't really have the biomechanical answer here, but what I do as I get in here, I do like a push adjustment on that rib. So it looks like this. So I get in there and I adjust it like that. And it's moving a little bit better. This one's a little fixated as well. So I get in there and move it too. So all of my adjusting kind of developed from when I hurt my shoulder. Remember we told you about that? So I couldn't push. So I had to use other parts of my body to adjust. So that one I do over the leg, right? So you have the leg. This one is a hip adjustment. So if you notice, I'm adjusting with my hip. Okay? So I'm using a good amount of force. So I'm not pushing. I'm not using this. I'm using this to do the adjustment. So in the neck position, it's probably not as important. You could do a little bit of that, but I'm mobilizing that joint there on the first rib. And he ends up off the table. And that's it. And then flip over. I think we sit down a bit this way. Okay. I'm working with a couple different groups on adjusting, so I'm not sure what I've done with you guys and the other guys, so refresh my memory if I've done this or not. Okay. On the upper, bend your knees. On the uppers, you've got to lift your hips. Right? Did we talk about the sandwich?
Maybe.
Okay, no. You have to have your hand over your hand. You can't do an adjustment, AP adjustment rear, like that. It's got to be directly over. In the upper thoracics, it's hard to do because of the here, this kind of thing. So to get that to happen, he's got to lift his hips. Right. Tight hug. So I'm going to get right on about T1, T2, and roll them over. Lift your hips. If I do that, and get in there. Start to get the hand over the hand, and then do the adjustment. Put your hips, your legs down. If I don't do that, I get in here. My hands are offset, and if I drop, I'm dropping like that. As he lifts his hips, I drop like that. Okay, so my force is going to do something. All right? So that is your upper thoracic adjusting. I would try both. I would try the ADP move with the hips. Remember, if it doesn't go, it doesn't pop. Don't. If you really feel it needs to go, come and get me. I'll come in and adjust it. That's fine, but you guys are practicing and learning. If it doesn't go, don't say anything. Don't act like it's a problem. Just go, great, got that joint moving a little more. Let's have you turn over, go to the rib. Mobilize, mobilize, if it goes, it goes. If it doesn't go, it doesn't go. You have to just do this now. You have to just do it. But we also got to get the patient the right adjustment. Grab me. If this is the key thing, the patient really needs this, just get me to come in and do it. But you're practicing, okay? So part of it is just not communicating to your patient that, oh my gosh, it didn't go, I'm frustrated, and I'll never get this. All right? So practice that today. And we'll see you in the rooms.